Monkeypox. That's right. Monkeypox continues to spread, with nearly 3,500 confirmed cases now reported in the United States alone. The Biden administration is weighing whether to declare the outbreak a public health emergency. According to the Washington Post, Biden's decision could come this week, tied to a planned announcement that about 800,000 additional vaccine doses will be distributed following completion of a review by the Food and Drug Administration. Today, Matt Ford described the symptoms of the viral disease, which he contracted in June.
I got a call on Friday, June 17th, alerting me that I'd been exposed a week before. Shortly after, I had really intense flu-like symptoms pick up, and then I had lesions appear all over my body. At its peak, I counted more than 25 all over.
Joining me now is White House Chief Medical Advisor, Dr. Anthony Fauci. Thank you so much, Doctor, for joining us this evening. First off, I just have to ask, because we're hearing this term monkeypox, we know that it's spreading, it's 3,500 people. How is monkeypox spread? And do we have concerns that the way it's spreading now may change and metastasize over time?
Well, it's spread by close skin-to-skin contact. The lesions are pustules on the skin. Sometimes you can make them easily visible. You see them. Sometimes in their early form, you may not notice them or confuse them with other skin lesions. But it's really skin-to-skin contact is the major way. Likely, if you have pustules that spill over, for example, onto clothing or other inanimate objects, it can spread. This is a virus right now that it has inserted itself into the community of men who have sex with men. And about 99% of the cases that have now been reported are within that demographic group. That doesn't mean that other groups are going to be essentially free of it, because there can be a spillover into cases. So that's why we're taking it very seriously. First of all, for the community at risk, we want to make sure that they are protected. We want to make sure that they get enough testing, enough vaccination, and there's a therapy for it. But it is a problem, Jason, that we take very seriously, because it is spreading at an alarming rate. As you showed the numbers there, now more than 80 countries have had over 18,000 documented cases, and that's probably an undercount.
So you're saying it's primarily through sort of intimate sexual contact. Should we, as a country, from a public health perspective, should we be moving back to maybe 2020 or at least early 2021 standards, where we go back to social distancing, where we no longer shake hands, we just sort of do elbow bumps? You're saying that's not necessary?
No. I think the idea, don't confuse that, Jason, as social distancing is when you're dealing with a virus that is transmitted by the respiratory route. There's no indication at this point that it is transmitted by the respiratory route. All indications from the demographic and epidemiological profile is that it is transmitted by close skin-to-skin bodily contact, which is the reason why when you listen to the people who have been afflicted with this and you talk about the circumstances, thus far, almost invariable, they say, well, I had a sexual contact over the weekend with someone I didn't know very well, and now all of a sudden, a few days later, I have these lesions appear. That is a recurrent theme. There's no indication at this point, although you always keep an open mind as to other modalities of spread. At this point, it doesn't appear to be anything other than what we're talking about, close person-to-person, skin-to-skin contact.
So, Dr. Fauci, we've seen sort of a rise in cases again, the BA.5 variant in places like Los Angeles and Dallas. And we've also seen a number of prominent public officials, Vice President Harris, President Joe Biden, Manchin, Susan Murkowski, have all caught COVID. My question for you is, many of them have sort of made a point of saying, hey, look, I got it, I'm taking Paxlovid, I'm happy I'm vaccinated, and I'm working through it. But at the same time, we've also seen reports that say that this idea of working through COVID may actually strain the body and lengthen the systems. Where do you stand on this idea that people should be working through COVID regardless of how mild they think their symptoms are?
Well, first of all, that's a really good question, Jason. Thank you for asking it. It really depends upon your symptomatology and your energy level. I'm one of those people who were vaccinated, doubly boosted, who actually got infected. I had a very, very mild case. I had a little bit of a sore throat. I had 1 day of a fever that responded very well to Tylenol. And I had one night where I was having a lot of running nose and blowing my nose. The next morning, I went on Paxlovid that night. The next morning, I felt very well. I didn't stress myself, but I did work in my capacity as the director of a research institute. I did work via virtually on a Zoom. I rested a little bit more than I usually did, but I essentially fulfilled all of my functions. Now, if I was sick with a high fever and aches and real fatigue, certainly I would not have tried to push myself. So what you're trying to say is don't push yourself, but do what you can do in a measured way, being prudent about it. That's what I was doing, and that's what the president actually did. I mean, he performed many of the functions because each day he was feeling better and better, and he continued to improve. So there's nothing wrong with fulfilling your functions so long as you do it in a protected environment.
Dr. Anthony Fauci, thank you so much for coming in and talking to us tonight.
My pleasure. Thank you for having me.